Discussing high risk surgical patients. High risk surgical patient. In the last lecture, in the last section, we discussed that how we will identify the patient, a high risk surgical patient, using various scoring systems. So, in this third part of the lecture series, we will discuss that what peri-operative care we will provide to this patient. Peri-operative care we will provide to a high risk surgical patient, and what are the general aspects of this care. So the topic is general aspects of peri-operative care of a high-risk surgical patient. So the first step is pre-operative assessment. Pre-op assessment, that before the surgery you assess the patient by taking history. And remember that focus on the cardiac system and cardiac and the respiratory issues of the patient. In the pre-op assessment, what you do, you check for the exercise tolerance of the patient, and you also check for the age and BMI of the patient. These are good indicators, are the usual indicators in pre-op assessment. And check the alcohol intake and tobacco intake, and also check the medication what the patient is using. So what we do in the pre-op assessment, we take history by focusing mainly on the cardiac and respiratory problems and checking for the exercise tolerance, age, body mass index, alcohol, tobacco intake, and various medication that the patient using. In the next step, in the second step, we check the pre-operative medical therapy. That before this surgery, what type of medical therapy the patient is using. So mainly in this section, we also focus on cardiac issues and respiratory issues. So in the cardiac issues, the patient is using any medication for the CVS problem, let him continue, don't stop the medication. Same is case with the respiratory system. If the patient is suffering from chronic obstructive respiratory pulmonary disease, so give the patient steroid course plus proper bronchodilators so that it does not cause any complication after the surgery. And in the third step, we provide critical care to the patient. Third step is critical care to the patient. In the critical care system, care of the patient, what we do, we check various parameters like pulse rate, respiratory rate, pulse oximetry, that's oxygen saturation for example, and we check the Glasgow Coma scale of the patient for conscious level, and we also check urine output, we also check blood pressure of the patient, and we also check the glucose level of the patient, and we also check the for any type of anemia so that we arrange the blood. So in the critical care, we manage these parameters, these 7 or 6 parameters. By the critical care, we aim to maintain the tissue perfusion and oxygenation of the tissues. We want that there is optimal maintenance of tissue perfusion and oxygenation of the tissues, and also we want to know that is there any problem and how we will respond to this problem if it occurs in the future after surgery. So in the fourth step, like once you are done with surgery, now the patient is in the post-op state. So how will you manage if there is any respiratory problem? How will you manage respiratory system after the surgery? So post-op respiratory management. Most of the time there is respiratory depression. So the patient develop hypercarbia, that increased carbon dioxide concentration, which leads to respiratory acidosis, which leads to acidosis. So this acidosis is not good for the patient. It can be hazardous for the patient's health. So how will you manage this? Proper oxygenation by the help of ventilation. So there are two types of ventilation that we provide to the patient. Ventilation, one is called invasive ventilation and the other is called non-invasive ventilation. Invasive ventilation is provided with the help of endotracheal tube or tracheostomy, and the non-invasive ventilation is provided with the help of mask, etc. Okay. And in the fifth step, if the patient is having some serious problems How will you treat this? Most of the time patient will circulatory collapse or shock. How you will manage it? It's very simple. Follow ABC: airway, breathing and circulation. Maintain these three parameters. Okay. Give the patient oxygen. Give the patient IV fluid. If the patient need blood, arrange the blood for the patient, and then give the patient inotropic agent so the contractility of the heart is improved. And also check for the urine output. So all about this is all about the peri-operative care of a high-risk surgical patient. Thank you very much.